would say that I don't think that there's anything that is likely to be better than or as good as those right now for this specific situation, especially with someone who has a known history of ADHD. And as you felt you were doing better on those higher doses, I think that that would be an important conversation to have with them. But we use stimulants a lot for patients who are recovering from brain masses. Whether we think it was actually a blood vessel abnormality or not, is a different story, but it's still sort of our go-to to help patients who are struggling cognitively. Every once in a while, we try an Alzheimer's medication for very specific situations, but I just don't think that that makes a lot of sense for you. And I think it's going to come with a host of other potential downsides that I just don't know are worth it.
Is there any way that you can support her in communicating that with her doctor, her psychiatrist?
I can. I just have to sort of know what the best way is to get in touch with them. This is Allison Marrier. Okay. Okay. We can see if we can try to connect with her. Let me just sending a message to our nurse practitioners to see if they can connect with your psychiatry nurse practitioner to just relay this information. Because I will not be here this afternoon, and then that way this hopefully could happen sooner. Okay, great. Okay, so brain imaging was great, no changes. I think that we could move to just getting an annual scan. This was 6 months, I think. And I think that we don't need to look more frequently than that because of how good things have looked. It hasn't changed. And we don't anticipate that it will go away, but it's a medium size and kind of sitting there and not doing anything right now. And so a lot of times people can have what we presume this to be a cavernous malformation, and people can have cavernous malformations for their whole lives and never have them cause problems. Some people have lots of them, and sometimes they bleed and then they cause a problem. And then if they stay stable, we don't have to do anything else. And so I think we should just watch if you were to develop, because Dr. Choi didn't think that it was a good idea to go in and take it out. If you were to develop sudden worsening of neurologic symptoms or headaches, then of course you would have to be seen locally, emergently. And then if something had changed, we would make a decision then about what to do. But it's very possible that this was kind of one episode where this became a problem and it may not cause any additional problems, which is the hope. And certainly we don't see any evidence that it got bigger in size. And watching more frequently isn't going to change management, if that makes sense, which is why I think that it makes sense to spread out the interval between getting images. And again, hopefully now that you have a shunt there, even if it were to bleed a little bit, it would be unlikely that it would cause a problem, or even if it were to get a little bit bigger. But we would just want to know if you were suddenly feeling like you were having new or worsening symptoms. Yeah, so that where this is, it kind of actually is pushing a little bit on the part of the brain that is communicating information about the right side of your vision. And that might be related to what you are describing, where you said that your vision had been affected initially on the right and has gotten a little bit better. So it's just that it's kind of where it is right up against that particular structure. That isn't any different than it was before, but that's what they're commenting on. I think, try what has worked before and are the current medications, and try to get the most we can out of those before we think about adding something else. Good. Hopefully that will. Okay. Well, reach out if you need me. work on setting up the follow-up. Okay, take care. It's good to see everyone.
Thank you.
Bye-bye.
Bye.
Right.